Hello, everyone. My name is Aiden Pico, and today I'm going to be talking about tetanus, specifically Clostridium tetani. So, some history on it. Tetanus was known about since around 5th century BCE. In 1884, scientists induced tetanus in animals by injecting them with pus from a person who had died from tetanus. Around 1889, this guy right here on our right, Kitasado Shibasaburo, isolated the tetanus germ from a person, proving it to be caused the illness in animals. He also discovered that specific antibodies could neutralize the toxin produced by the tetanus germ. By 1897, Edmund Nocard showed that transferring antidotoxin could protect against tetanus. This method was used in World War I for treatment and prevention. In the early 1920s, a way to inactivate tetanus toxin was with formaldehyde was developed, leading to the creation of tetanus toxoid in 1924, and it became widely used during World War II. Now, what is tetanus? So, tetanus comes from a bacteria called Clostridium tetani. These bacteria make a toxin that make muscles hurt a lot. Lockjaw is another tetanus name because it can tighten the neck and the jaw muscles, making it tough to open the mouth or swallow. Causative agent, reservoir, and vector. Now, the causative agent for tetanus is Clostridium tetani bacteria. Now, soil is the main reservoir for C. tetani, but many animals, both herbivores and omnivores, carry the bacilli in their intestines and excrete the spores in their feces. Now, tetanus is not a vector or transmitted from person to person. But good thing to know is the spores of tetanus bacteria are everywhere in the environment, including soil, dust, and manure, and the spores develop into the bacteria once they enter the body. Now, some common modes of transmission. Now, we have wounds contaminated with dirt, feces, or saliva, puncture wounds, burns, crush injuries, or even injuries with dead tissue. Now, these develop into the bacteria when the spores germinate in anaerobic conditions, like in our bodies, and then the toxin binds into the central nervous system, which interferes with our neurotransmitter release to block inhibitor impulses. And this leads to unimposed muscle contraction and spasm. Now, tetanus bacteria can also infect someone's body through breaks in the skin, and these could be caused by clean superficial wounds when only the topmost layer of the skin is scraped off, surgical procedures, insect bites, dental infections, compound fractures, chronic sores and infections, intravenous drug use, and intramuscular infections. Fun fact, a recent case report in 2022 presented a 44-year-old male with tetanus from a dental infection, and he displayed symptoms like trismus, neck stiffness, and rhizus sardonicus. Now, incidents in the US and worldwide. Worldwide, 75 million women and their babies remain unprotected against maternal and neonatal tetanus. And tetanus, however, in the US is very uncommon, with an average of 30 reported cases each year. Here on the right is a graph of tetanus in the US. So as you can see, in the early 1900s, there were many deaths that were caused by tetanus. But as we get closer to the 2000s, deaths and even incident cases like flatline, explaining why the tetanus in the US is very minimal. Now, some symptoms of tetanus is jaw cramping, sudden involuntary muscle spasms, sometimes often in the stomach, painful muscle stiffness all over the body, trouble swallowing, seizures, headache, fever and sweating, and changes in blood pressure and heart rate. Here on the right is a little explanation. Here, this guy steps on a nail that contains tetanus. And as it develops, he starts getting muscle spasms and stiffness in the jaw as he tries to eat his burger. Now, here are diagnostic tests that are used. Now, tetanus diagnosis involves several key factors: a thorough physical examination, reviewing medical history, assessing vaccination records, and noting symptoms such as muscle spasms, rigidity, and pain. Now, typically, doctors prioritize clinical evaluation and history to diagnose tetanus before turning to laboratory tests. However, if there's suspicion of another condition sharing similar signs and symptoms, laboratory tests might be considered to rule out alternative diagnosis. Ultimately, the diagnosis heavily relies on observed signs and symptoms, with testing used selectively to exclude other potential conditions. Now, tetanus isn't commonly mistaken for any other diseases. Like as I said before, it's very uncommon today in the US, but it can be differentiated between mild or severe. So listed below are symptoms of tetanus when it's severe. So first you have laryngospasm, which is uncontrolled involuntary tightening of the vocal cords, fractures like broken bones, pulmonary embolism, a blockage of the main artery of the lung or one of its branches by a blood clot, aspiration pneumonia, which is a lung infection that develops when things like saliva or vomit accidentally go to the lungs, and then breathing difficulty, and then tetanus can lead to death. 1 to 2 in 10 cases are fatal. Now, treatments for tetanus. Now, the disease progresses for about 2 weeks, and recovery with these treatments can last about a month, give or take. Now, first we have the anti-tetanus immunoglobulin. This is also known as tetanus immunoglobulin or tetanus antidotoxin. It is a medication made up of antibodies against the tetanus toxin, and it's used to prevent tetanus in those who have a wound that is high risk or have not been fully vaccinated with the tetanus toxoid. Fun fact, it's also used for HIV and AIDS. And then we have the antibiotic metronidazole. This antibiotic kills the Clostridium tetani bacteria. Now, some side effects of anti-tetanus immunoglobulin. You have difficulty in breathing or swallowing, hives, itching, especially those on the soles or your palms, the reddening of skin, especially around the ears, swelling of eye, face, or inside of the nose, and unusual tiredness or weakness, sudden and severe. The side effects of metronidazole is vomiting, nausea, diarrhea, constipation, upset stomach, stomach cramps, loss of appetite, headache, dry mouth, sharp, unpleasant metallic tastes in the mouth, or furry tongue. Now, a new development, future medical research direction. As I said before, tetanus is uncommon in the United States, with an average of 30 reported cases yearly. This is due to the immunizations given to children in the US. And it's been shown that tetanus has not changed enough that new and improved treatments and vaccines have had to be made. However, maternal and neonatal tetanus poses significant global health challenges, particularly in regions with limited immunization access and inadequate birthing practices. Infants affected by tetanus face mortality rates between 80 to 100%. And then the Global Burden of Disease study in 2019 identified over 73,000 total tetanus cases, with 27,000 neonatal infections and approximately 34,700 deaths worldwide. So most fatalities occurred in South Asia and sub-Saharan Africa, like I have on the right. And the World Health Organization notes a rising burden of tetanus among adult men, especially in those areas. Now, for future directions, what would I do to stop tetanus from spreading? Um, I'd try to administer tetanus vaccines for everyone. Administering these vaccines can be the key to eradicating tetanus and saving countless lives in various countries. Here's my reference lists. And thank you for listening. I hope all of you guys enjoy the rest of your break. Have a nice day. Thank you so much.